Good day, everyone. For today, we're going to show you the different methods on performing bleeding time. Now, the materials for bleeding time are the following: disposable lancets, filter paper, stopwatch, wet and dry cotton, normal saline solution, sphygmomanometer, surgical device, and our water bath. The first method that we'll be performing is a Duke method in the earlobe. To start, we are to clean the site with alcohol and allow it to dry. Pierce the earlobe with the lancet, making the incision 3 millimeters deep, and then start the stopwatch immediately after the puncture. After that, blot the blood with filter paper at 30 seconds interval. Move the filter paper so that each drop of blood touches the clean area. Do not touch the incision directly with filter. And lastly, stop the stopwatch and record the time as soon as the filter paper shows no signs of blood. The next method is a Duke method in the finger. They have the same procedure with the first method. Clean the site with alcohol and allow it to dry, and after making an incision of 3 millimeters deep, blot the blood with filter paper at 30 seconds interval. Again, make sure to move the filter paper so that each drop of blood touches the clean area. And lastly, stop the stopwatch and record the time as soon as the filter paper shows no signs of blood. Now for our next method, it is the IV method. So the first thing you need to do is you need to place the blood pressure cuff on the patient's forearm above the elbow and inflate the cuff and maintain at 40 mmHg. Clean the outer surface of the patient's forearm with alcohol. The area should be free from superficial veins and scar tissue. Next, you hold the skin tightly and make 3 small punctures about 3 millimeters deep and 1.5 centimeters apart. Now, start the stopwatch. After starting the stopwatch, you blot the blood with 30 seconds interval using the filter paper. And as always, you move the filter paper so that each drop of blood touches a clean area. Stop the stopwatch when the filter paper no longer shows signs of blood. The average of the times for bleeding to stop from the 3 puncture sites is recorded as the bleeding time. For the Capillary immersion test, we need to prepare a beaker of NSS in 37 degrees Celsius. We need to clean the finger and make a very deep puncture. Now, start the stopwatch immediately after the puncture. After that, submerge the finger in the pre-warmed beaker with NSS. Observe the flow of blood that comes out of the wound. Stop the timer immediately as soon as the bleeding stops. For the surgical method, you need to remember that the preferred site for the procedure is 5 centimeters below the antecubital crease. The first thing that you need to do is to place the sphygmomanometer on the upper arm of the patient and inflate it to 40 mmHg. The time between inflation of the cuff and incision should be between 30 and 60 seconds, and hold at this pressure for the duration of the test. Clean the arm with wet cotton and allow it to air dry. Remove the surgical device from the blister pack and carefully not to contaminate the instrument. Remove the safety clip and then hold the surgical device securely between thumb and middle finger. You gently place the surgicat on the forearm and apply minimal pressure so that the instrument is slightly touching the skin. Push the trigger and start the stopwatch at the same time, and the surgicat produces a standard wound of 5 mm long by 1 mm deep. Remove the surgical device from the forearm immediately after making the incision. After 30 seconds, same procedure, blot the blood using filter paper and blot the blood every 30 seconds until blood no longer stains the paper. Stop the timer when the bleeding stops. Bleeding time is determined to the nearest 30 seconds. If the bleeding continues after 15 minutes, terminate the procedure and apply pressure to the incision site. Remove the blood pressure cuff and carefully clean the area with cotton. And apply bandage vertically and keep in place for 24 hours. So that's it for today, guys. I hope you're able to learn something from all the methods for bleeding time.